Welcome to our project. My name is Iker and my teammates are Sydney, Payton, Milo and Tyler. For this project, our team worked with the local office of SKYATECH, a company based in China that is working on the development of a patient-specific instrumentation for total hip arthroplasty. Hip osteoarthritis is the wear down of the hip joint cartilaginous tissue due to aging, mechanical strain, or certain diseases. When the pain or disability becomes significant, total hip replacement surgery is recommended. The total hip arthroplasty replaces the damaged hip joint with a two-piece prosthesis, the acetabular cup which is placed on the diseased hip, and the femoral component that will replace the diseased femoral head of the patient. The project goal was to create a 3D printed guide to assist during the surgery and prevent the mispositioning of the cup during surgery. Currently, surgeons use a tool like the one shown on the top left of the screen. This tool comes with a visual angle guide that uses the floor as a reference. The problem with this guide is that if the patient hip is not parallel to the floor, the angle from the guide would not be accurate. For this reason, the angle guide, in most cases, is not helpful in surgeries. So surgeons depend on their experience or X-rays confirmation, which can end on a misalignment of the cup or make surgeries longer, increasing the risk of infection. 3D printed guides like the one developed by our team have been recognized as a safer and inexpensive solution to reduce the mispositioning of the cup. Our guide is developed using a specific hip anatomy of the patient to avoid any potential angle error. What this means is that by using CT scans of the patient hip, we can shape the guide to their specific hip topography. So when our guide is used in surgery, the shape will allow a snug fit on the patient acetabular rim, ensuring the correct angle. The way our guide works in surgery is that just before preparing the area for the prosthesis cup placement, the surgeon places the patient-specific 3D printed guide on the patient acetabular rim. For extra security, a holder attachment can be used to make sure the guide stays in place when drilling the surgical pins. Then the surgeon will use the superior guide to insert the 3 pins on the patient hip. Here, the surgeon can verify the angle by placing the hand guide on the pins. Then the guide used to insert the pins is removed to free the area for preparation and placement of the cup prosthesis. The hand guide placed on the pins will indicate the correct angle surgeons will use as a reference when preparing the area and placing the cup. After the cup is placed, the hand guide can be removed and the pins can stay in their position without affecting the rest of the procedure.